Hi, everyone. Welcome to today's webinar on William James College's Master's in Clinical Mental Health Counseling program. I hope you're all excited to hear from our presenters today and get a lot of the information you're probably looking for about this program. So on the next slide, you can see who you'll be hearing from today. My name is Sarah Johansson, and I work in the marketing department here at William James College. I will be your host for today's webinar. So I'll give you a little bit of an overview of the college and all the departments and programs we have here just quickly. And then we'll get into our presenters today. We have Dr. Mari Carmen Benassar, who is an assistant professor in the counseling program and also the director of our Latino mental health program. And then we also have Joseph Lesh, who's our associate director of admissions, who will be giving you a little bit more information about the admissions process at the end of the webinar today. So on the next slide, I just want to go over a few housekeeping things before we get into the presentations today. So this is a live webinar, and we really want it to be as interactive as possible. We really want you to get all the information you need and that you came here today to get. So at any point during the webinar, definitely don't hesitate to type any questions into the question box there. There will be some time in the webinar today for us to make sure we get those questions answered for you. I also want to add that in the handout section, you can download a PDF of today's presentation. So I highly recommend that you do this, and you can get all the information saved to your computer. You can look back on it. There's some contact information at the end that you might want to save. So I definitely encourage you to take a moment to do that. So if we move to the next slide, a little bit about William James College. So our college is located in Newton, Massachusetts. On the map there, you can see that we are located with easy access to a lot of major highways, and we are close to the city of Boston. So it gives our students a great opportunity to live near Boston, work in Boston. We have a lot of great organizations in the city and in the greater Boston area that our students participate in their field placement sites, their internships. So it's really a great central location for our students to both have their education and then to experience their life outside of the college. On the next slide, we have just an overview of all of our departments and all of our programs that we offer at William James College. Obviously, all of you are interested in the counseling department, but just to go through all of the great work that we're doing here, we have a clinical department where we offer a PsyD in clinical psychology. We have an organizational and leadership department where we have a number of degrees in leadership psychology, organizational psychology, etc. And we have a school psychology department, again, with a number of degrees in that field. And we also offer a bachelor's completion program. So we have a bachelor's of science in psychology and human services. So just to give you a little bit of an overview of everything that William James College does, all the different people, professors, peers that you'll see around campus or experience in your classes and as you become a student here at William James College. So on the next slide, I just want to quickly go through our core values. So these three values extend across all of our programs, all of the work that we do here, and they're really important to everyone who works at William James College, all of our students who attend school here. So first, we have experiential education. Right from day one, all of our students really get into the field, whatever program they're in, and really get a hands-on experience with those skills. So this is really important for us. We really want to not only have our students learn in the classroom, learn through a lecture hall, but really get to work in the field, do those things that they're learning in the classroom in real life, and get those experiences. Secondly, social responsibility. So again, we don't want our institution to just be limited to the classroom, just be limited to the William James College campus. We really do a lot of advocacy here. We have centers of excellence, and a number of different initiatives where we really want to make a difference in our communities, in the local Newton community, in the Boston community, and in many communities all around the world. And then lastly, personal growth. Our students leave William James College not just with the degree in hand, but really getting a full experience of working in a mental health field. They get their experience with their faculty members who are practitioners, in addition to professors who have worked in the fields, who have really amazing resumes, and our students get those experiences. They connect with peers on campus, online. So really we try to make the William James College experience more than just the classroom. So on the next slide, just a quick update on the COVID-19 situation and how William James College is responding. We have moved all of our classes online, and our staff and faculty continue working remotely. So you may know that we have already offered online programs through our organizational and leadership psychology department, for example. So we're well equipped to make the transition to the online space, and we've seen success in that so far. Faculty members who hadn't previously instructed these online courses, they've adapted to the new format, and even now they still continue to develop additional skills, participating in training sessions, working with online education experts to make that transition. So although we look forward to returning to campus when the time is right, we are embracing this new delivery model, and we're thinking creatively about this situation. So we're fully prepared to continue classes online this fall if the public health emergency requires it. So on the next slide, we want to just have a quick poll so you can share with us what you're doing right now. This will give the rest of the webinar a little bit more information on who's in the audience today, and we can make sure that we're talking about the right things. So if you could just take a minute to answer this question. Okay, great. So it looks like many of you are undergraduate students currently, which is amazing to see. And we have a bunch of other people across the board, which is no issue at all. So we will just make sure that you get all the information you need about whatever you're looking for from the counseling program. So again, I just want to reiterate, put your questions in the question box if you have them. And without further ado, I would like to introduce Dr. Benassar.
Good afternoon. I'm very happy to be here. Thank you, Sarah, very much for the introduction. I was said at the beginning, I'm a core faculty at the counseling program, which is what we're focusing today about work at WJC. And I'm the director of the Latino Mental Health Program, very much part of our multicultural, cross-cultural inclusiveness mission at William James College. I'm happy to be here and hope to answer the questions that you have today. The next slide. So starting with, what are the requirements of if you were to come here to complete your master's degree in counseling? It's a total of 60 academic credits, and you will see in other programs, master's level degrees have usually divided into like 30-something credits and 60 credits. Please be aware that if you want to be an independent a practitioner, you do need a degree with the 60 credits that leads you to the licensing in mental health. The way that we offer students to complete these 60 credits, and that goes together academic classes with the experiential a practice that Sarah mentioned before. You can do this either 2 years full time, and this is including summer session. We have a summer 1 session, and you get then a month and a half before the fall session. Or for the ones that would like to start slower, we offer a 3-year option where the first year people take just classes but do not participate in the practice, in the experiential, or go to clinics, and then start the clinic practicum in the 2nd year and the internship in the 3rd year, and that's completed. As I said, our classes and requirements meet get you ready for the licensing in mental health counseling. This is called in different ways in different states, but in Massachusetts it's called the license for mental health counselors. Next. This is about the field of education. As Sarah mentioned before too, one of the things that differentiates us perhaps of other schools is that we start at the same time that you start your academic curriculum. You will start at that same end of August at a clinic, at a school, at an institution, starting your practice. The first year we ask that you complete 360 hours per year. Usually that goes 9 to 10 months out of the year at an average of 12 hours per week. And in year 2, what we call the internship, it's more intensive, and 600, you will complete at least 600 hours. Most students complete more than 360 in the first year and more than 600 in the second. This again prepares you for the licensing exam. Thank you. Another one. Thank you. One thing that we want to add, I thought I had some a different slide for the field education. So I'm going to add something that is regarding to the last slide that we said, the field education. I want to stress that we have, thank you, that we have all kinds of sites. Let's say that you were accepted to our institution and you decide to come and join us, you would be contacted by the director of the field education department in the counseling department to start during the summer, before you come here, working on your resume, your cover letter, and looking at what experience do you have. We have a very diverse pool of students when they come from backgrounds of non-psychology to people who have already a degree, a change of career, or have a lot of experience in the field and are coming to get the master's. So we look personally, and that's kind of like the individual attention that in your personal and professional growth that we're going to focus on. And based on that, we would pair you up with different sites that based on that experience, so you can apply. But we join you and we do this all with you, the process of education. And we have again a myriad of sites, from hospitals to elder care to schools to rehabilitation centers. So a very different site to meet the interests and needs of our students. Okay, now the next, thanks. And we are very proud to say that we just started the option of an online master's program. And this is a summary of the requirements. It's 60 credits, the same as the in-person training. This program has 2 entry points. You can apply to enter in the late August, or you can apply in January. Actually, our live program, in-person program, also has 2 points on entry. You can apply to start in January, and that's completed in 2.5 years, the same as the online enrollment here. The time to complete is 2.5 years to 3 years, depending on when you come in. 2 summer residencies. So again, practicum and the internship. We have asynchronous classes, meaning you work online for most of the classes, with the exception of clinical seminars, and these are a mode of supervision seminars. So at the same time that you are at a site, you're going to have live online classes with your professors in a mode of supervision of the work that. Did I mute myself? Was I muted when I was talking?
Dr.
We can
Benatar,
hear you
yep.
now, Mari.
Yep.
Okay, so I maybe I had pressed something. So did you hear me say something about this slide?
You were muted for just a moment there.
Oh, so that was strange because I haven't talked anything. So I apologize for that. But these are the requirements I don't want to repeat. But the most important part is that the online program meets also the requirements for licensure in Massachusetts and New England. And again, we're happy. I'm not sure that there's someone interested in the audience, but we're happy to answer more questions about this program too. Next. And this is part of what I thought I had before, which are the different types of, these are examples of all the different sites that we have. We have over 300 different contracts with people in our communities, only in Massachusetts, and actually surrounding states, also in Rhode Island and New Hampshire and Connecticut too. So we're trying to meet your needs and your interest in matching you with a practice site. Next. Any questions? We'll leave it with that.
Thanks, Mari. So again, if you have any questions so far, feel free to submit them now. We don't have any at the moment, but there will be another opportunity at the end of the webinar today. So if you have any questions coming up, there will be another opportunity there.
Perfect.
Okay, so it looks like we have another audience poll for you guys to just take a moment to answer. So if you just take a moment and let us know what area of emphasis you are interested in. Again, this will just help us to know who's in the audience today and where your interests lie.
Focus, yeah.
Okay, great. Looks like 50% of you are interested in general mental health counseling, and then we have some interested in forensic and others in health and behavioral medicine. So it's great to see. So we can move on to the next slide there. And I'll turn it back over to Dr. Benatar.
Thank you. Welcome back. And let me say, these are all emphasis specializations that we offer as, I would say, kind of like a tip of, kind of cream in the ice cream kind of thing. We are generalists, and I want to emphasize that we always, regardless if you choose an emphasis, when a student comes in, the first task is, or the main goal is to graduate you as a generalist, as a strong clinician to work with any community. And the focus of the skills on top of that are going to be in some of your interests here, let's say forensic or substance abuse and so forth. I think that's important because sometimes I get that question of, like, if I'm a substance abuse counselor, am I going to be able to see general population? Absolutely. But on top of that, you're going to be coming out with specialized knowledge on substance abuse or health and behavioral medicine, forensic, and so forth. I will focus on, I mean, substance abuse and family and couples are self-explanatory, and seems like nobody was specifically thinking about that. Forensic and correctional counseling is focused on, when I said any forensic work. Forensic work, it means that is related to the law. So it's not, it can be as your private practice and working with people who have been involved and impacted by the law, and to working in prisons, correctional facilities, and so forth as a mental health counselor directly with the inmates, or doing evaluations and so forth. The health and behavioral medicine program, it really addresses the great need today of integrating psychology, mental health with our physical health. So especially in Massachusetts, there's a great movement of bringing mental health into the health system, into the medical system. And this specialty kind of introduces you to that work. And again, even if you have this specialty, you can work in general and with, let's say if you have a private practice or work in a community health center, these will be addressing the needs of people with chronic illnesses, death and dying issues, and medical issues, adapting to their new self if they have impacted health, and so forth. So very interesting work to do. Next. And in addition to the counseling program specializations, we have other concentrations with the same thinking that actually are offered all departments of school. Sarah mentioned at the beginning how we have the school psychology, and we have an organizational, and we have a clinical psych. So all students from this program can join any of these specialties, which actually offers a great space for multidisciplinary thinking, right? As we have the Latino Mental Health Program, it's called the Lucero Latino Mental Health Program. It's our oldest concentration, more than 12 years, 13 years now. And we have an African Caribbean mental health, a global mental health, military and veterans, and our new, we launched this fall, our Asian mental health program. And I would like to say that all these programs are very interconnected with the mission of, again, addressing the needs of typically marginalized, underserved populations. And we work very actively in the school with not just in academics, but activities and conversations and so forth. I think they're self-explanatory. I would say the Latino mental health, we talk about, it's a series of academic courses with some requirements for your practice. If you're doing African Caribbean, to work a certain population, percentage of the population you work with should be of African or Caribbean descent. In the global mental health, there's a twist of really focusing on the mental health of refugees, and global health from that perspective. But there's a great overlap and a lot of collaboration between these concentrations, including the military and veterans. The military and veterans was originally developed only for veterans, and eventually also it and actually currently includes civilians who are interested in working with veterans. So it's open to both. Next. There's a behavioral health initiative. If you're interested in this, please let us know and we can talk more about this either individually or in the group. But it's a partnership that WJC has created with community health agencies, local community agencies, in contracting and offering scholarships. Either for at the bachelor's level or in your case, you're interested in the counseling master's degree level. And it's a contract that offers a contribution from the center, a contribution discounted for the student, and a utilization of the practicum and internship that we talked about in that particular community place work, which we call it work as placement. Again, if someone is interested in exploring this, if you're working in a community health center, we can speak with you to see if your center meets the requirements and if you can continue to work there, enter this contract, receive that discounted tuition, and use the hours that you work, your paid hours that they are as credit for your practicum and internship hours. Next. We offer more than offer. We offer a lot of continuing education. I mentioned this, but the main point of our career, our teaching is that it's a very diverse area of professional area. You can do almost anything in the sense of careers of mental health, and this is some of the statistics. Like Sarah said, this is going to be available for you if you want to download it. But as you can see here, there's a myriad of opportunities in our communities for you to work in different roles in the community and in different settings. One thing that I know that nobody was interested in, it seems, in the marriage and family therapist, but the one thing that I want to say about that one is that if you were to come for that specialty, aside from getting the LMHC licensing, it also prepares you for the family therapist specialist license also. But mainly prepares you for, there's a great percentage, 93%, like you said, like you see here, of students that actually when they graduate, they already have jobs. And within 6 months, close to 100% have jobs. So, next. WJC has a career center. We have a dean of students who's very involved. The office of dean of students is very involved in, again, continuing education and assistance for students in connecting not only with job, but specific trainings on how to work with your resume and how to interview and how to advertise and kind of like put yourself out there. We host a couple of career days at WJC by department and by in the different departments where many local organizations look forward to meeting you in person there, and this is an opportunity for you to, without going to the actual places and seeing many places, talking to the people that work there and exploring the different opportunities. We have a person that is dedicated in that office to individually assist you in the process, again, of building your papers and documents and your strategies to negotiate, again, that transition after graduation. Next. Joe would need some help with this, but there's the Behavioral Health Service Corps with a offer. This is something that is relatively new, but it's a paid year of service to explore different opportunities in healthcare. I don't know if Sarah or Joe would have something else to add to these opportunities.
Yes, Dr. Benazar, I can add a little bit to this. So, yes, the Behavioral Health Service Corps is a brand new initiative that was launched by William James College this year, and it's
Mhm.
primarily aimed at newly minted bachelor's degree graduates who are interested in a career in human services and mental health. So, we have engaged with several community mental health agencies in the greater Boston area. And what we're offering is an opportunity for candidates to gain some entry-level experience in the world of human services and mental health counseling. And if
Mhm.
you become a member of the Behavioral Health Service Corps, you'll be able to apply for employment at one of these mental health agencies. And we'll also offer you the opportunity to complete up to 9 credit hours of graduate coursework in mental health counseling. And so we'll give you the opportunity to gain some work experience in this field, and you can earn up to 9 credits at no charge. Um, uh, these are credits that can be applied towards our Master of Arts in Clinical Mental Health Counseling program, the program that we're talking about today. And we are currently taking applications for this Behavioral Health Service Corps, and you'll see some information on our website. So if you would like to explore that further, please go to williamjames.edu and you can read about all of the conditions that we have for this program.
Wow, that was great. Thank you, Mr. Lucian. And actually, I'm going to make a comment now, given that as a result of your cooperation here, is something that it's not in the slides, but it's going to be my personal contribution here as a professional, is that one thing that I love about William James College and why I've been involved with the college for like the last 25 years. I used to work at another university before, and I've been here 11 years now. Is the collaborative and community sense that we have at WJC. The counseling program strives for that, and I hope that these kind of contribution with Joe can actually exemplify like how we're so collaborative, and that if you are looking for a place that feels like a community, looking for a place of education, it's about finding a place where you feel comfortable, that you feel at home, that you feel able and open to talk to your advisors and professors and your admissions counselors and so forth. We are that type of community. Some people prefer bigger universities and things like that, but we are really have maintained a sense of community and support in our community. So thank you, Joe, for that. The next. I think this is part of what you explained too. Joe explained part of these, the 2 weeks of orientation, William James. These are kind of the main requirements of what we just talked about. Employment, 9 credits in 3 courses. And of course, and this relates to our professional involvement with you, the clinical supervisory and mentoring throughout the year-long experience. So you will read that. And these are, I would like to say too that, didn't say these before, but as coming to the counseling program, we have a very nice ratio advisor to student. So you would get a very personalized mentorship with a professor or several professors. I would like to say that most of us are very easily reached and open to conversations, professional and personal conversations with students, and supporting your growth. So I hope I can convey that. That's special about our community. And next, last for me, how to apply. So if you can want to say that, I'll pass it to admissions.
Thank you, Dr. Benassar. Yes, this is just a summary of the Behavioral Health Service Corps application process. And my recommendation is that if you're interested in becoming a candidate for this Service Corps, send in your application fairly soon. We are receiving quite a bit of interest in this new initiative, and we plan to launch it later on this summer. So now is the time to apply. And you can see on the slide there, those are all of the application documents that we need: an online application, 2 recommendations, a copy of your undergraduate transcripts. And then once we have all of those materials, we'll review them. And if we will be inviting you to interview, we will contact you. And then from there, we will then refer all of your application materials to 1 or more of the partnering community agencies that we've set up for this initiative. And then you'll have a separate interview with the agency that has these open employment opportunities. So you can apply online at that link there, and we look forward to receiving your materials. Okay, so now I'd like to switch gears for a moment and offer to you in the audience, those of you in the audience who are considering an application for admission to William James College, a basic overview of how the application process works for admission to the Clinical Mental Health Counseling Master's Program that we're talking about today. And we'll also summarize for you all of the documentation that is required to complete your application portfolio. And then from there, I want to take a couple of minutes and talk about some financial aid opportunities that we make available to our candidates. So before we begin, I just want to advise everyone who may be interested in applying for admission about the timing of your application. So as Dr. Benassar mentioned earlier in the presentation, we enroll students in the Clinical Mental Health Counseling Program at 2 points in time during the academic year. So you can enroll for the start of our fall 2020 term, which begins in late August of this year, or you can begin the program at the start of next year's spring term, which for us begins in early January of 2021. So if you're interested in applying for a fall 2020 enrollment rather, this is the time to apply for admission. And if you're seeking enrollment for the spring 2021 term, a good time to apply would be sometime in late October to mid-November of 2020. For those of you who are considering an application for fall 2020 enrollment, I know many of you are curious about an application due date. And so, technically we can take an application right up until just a few weeks before the start of the term. But my advice to you would be, if you've made a decision to apply, submit your application now. Don't wait until we get closer to the start of the term. Give yourself plenty of time to write your application essay, and we also need time to schedule you for an interview. We'll talk a little bit more about that in just a couple of minutes. And also you need time to put together your financial aid plan for the program. So if you're ready to apply for fall 2020, submit your application now, and we'll process your application and schedule you for the interview as soon as it becomes complete. So let's review all of the materials that are required to have a complete application portfolio. So we'll ask you to furnish us with an online application, and that application will include a brief reflective essay we'll ask you to write, and that essay will probably run you about maybe 4 or 5 or 6 pages in length. And we give you some talking points to help you organize your thoughts around that essay. And we'll also ask you to furnish us with your academic transcripts from your bachelor's program. And then we'll also ask you to identify 3 individuals who will serve as references on your behalf. So you access the online application through our main website, And once you open the application for the first time, you'll be assigned a PIN number, and then you'll get to choose a password. So use this PIN and password to work on the application at your own speed. Don't feel compelled to do the application from start to finish all in one sitting. Open the application, write down your PIN and password, save that information, work on the application at your own speed, and access the application as many times as you need to. Once you're satisfied that it's ready to go, then you can go ahead and submit that. Now, once you decide to apply for admission, that's a good time to go ahead and contact the registrar's offices for each post-secondary college or university that you've attended, and then you can ask them to issue an official transcript directly to us here at the college. It's not a problem if that transcript arrives before or after the date that you submit your application, so don't worry about that. We'll reconcile everything into one file for you as these documents come in. And regarding letters of recommendation, just want to give you some additional clarification on that. We don't have a set policy as to whether references must come solely from academic or professional sources. So for those of you who are perhaps you've just graduated from your bachelor's program this past May or June, if that is the case, for references, you most likely will want to choose some academic references. So typically academic references are college or university professors. You can also consider academic advisors and department chairs. If your bachelor's program, for example, required a practicum or an internship, I would recommend that you consider practicum or internship supervisors. All of these sources make for really good academic references. Now, if that does not apply to you, if you're an individual that has graduated from your undergraduate program perhaps 3 or 4 or 5 years ago, most likely you have lost contact with these individuals, then in your case, it's perfectly appropriate for you to furnish 3 professional references. Now, I think it's worth noting here that the source of a professional reference does not necessarily need to be employment related. So, for example, if you have served in some volunteer or public service capacity that was related in some way to the field of psychology or human services, I would certainly encourage you to consider those sources as well. Volunteerism and public service is a big part of our culture here at the college, as I think Dr. Benazar had mentioned earlier. So we certainly encourage you to think about your volunteer and public service experiences as well. And those sources very often make for really good reference sources. So just a quick reminder that an interview is required as a condition of admission to the programs that we're talking about today. And interviews are scheduled by appointment. And so once we have a complete application file for you, we've received your application, your transcripts, and your references, we'll schedule you for the interview. And your interview will be hosted using the Zoom video conference platform. So we're not currently hosting interviews here on campus. We'll host them using the Zoom platform. And the format of that interview could possibly include a brief group activity where you would participate along with several other candidates for admission in this group exercise. And your interview may also include a brief reflective writing exercise as well. So basically, from start to finish, your interview should be done in roughly about 45 to 60 minutes. That's the time that we would need to complete that online interview. Okay, now I want to move on and talk about some financial aid opportunities that we make available to our candidates for admission. So I'm very pleased to tell you that we have some scholarship opportunities for admitted candidates to our clinical mental health counseling program. And we have several merit-based scholarships to offer. And these scholarships are typically awarded by the faculty members who conduct the interview. And so these merit scholarships typically carry a value of approximately 10 to 15% of the total tuition and fees for the program. And if you are the recipient of one of these scholarships, you will know the answer to that when you receive your offer of admission. So it'll be right in the body of the letter that you receive announcing your offer to enroll. The amount of the scholarship will be mentioned right in the letter. And the good news about the scholarship process is that unlike other schools, we don't have a separate scholarship application process. We don't require any financial needs tests to be met. These are merit-based scholarships. And so no other paperwork or applications are needed in order for you to be considered for a scholarship. If you're invited for an interview, you're automatically placed into that pool of candidates for that scholarship program. And so as Dr. Benazar had mentioned earlier in the presentation, we do have our Behavioral Health Initiative Scholarship as well. And so I just want to do a quick recap of that. These are scholarship opportunities for candidates who are already employed in a human services or behavioral health work setting. And typically the value of that scholarship is a 20% reduction in your tuition for the program. So if that situation applies to you, if you're a candidate who is already working in a behavioral health setting, you certainly want to be sure to include that experience on your resume, and we'll see it on your application for admission, and then we'll offer you the opportunity to present what we call a memorandum of understanding. You'll present that to your employer, and that memorandum is basically a contract that tells your employer these are the learning outcomes and the competencies that you must achieve during your field experience, because the whole point of this is that you want to complete your field experience at your employer's work site. So we want to make sure that that the employer can indeed fulfill all of those conditions. So we'll walk you through that process. And if everything fits together, then you will have two benefits. You'll get a 20% reduction in your tuition, and you'll be able to have the convenience of completing your field training hours, which is a requirement for graduation. You'll complete those field training hours at your employer's worksite. So in addition to scholarship opportunities, we also have a couple of other financial aid opportunities for our students, and these consist of part-time on-campus student employment opportunities, and then finally we have the opportunity for students to request financing through the U.S. Department of Education's Federal Student Loan Program. And it's worth noting here that because we have our new online Master of Arts in Clinical Mental Health Counseling program, if you decide to apply for admission to that program and you accept our offer to enroll, even though you're a fully online student, you still have access to all of the on-campus services and amenities that we offer. And one of those services is the opportunity to apply for open on-campus work study positions. So just wanted to make that distinction. So on-campus student employment positions typically pay an hourly wage, and the typical work schedule is usually about 8 to 10 hours per week. And so in a given year, through the federal work study program, a student might earn anywhere from $1,000 to maybe $3,000 or $4,000 in wages during that time period. And then finally, just a few words about financing opportunities through the Federal Student Loan Program. Most of our students who join the program do finance all or a portion of their tuition and fees using the Federal Student Loan Program. So to qualify for this type of financing, you do need to be eligible to file the free application for federal student aid, which is also known as the FAFSA. And most likely many of you did a FAFSA when you were in your bachelor's degree program. Process is essentially the same. And it's important to note here too that With regard to the FAFSA, it's a good idea not to wait until you receive your offer to enroll to start the financial aid process. So once you've submitted your application for admission, my advice would be that you then turn your attention to the FAFSA. And the FAFSA doesn't cost you anything, to do. So work on your FAFSA as soon as you have submitted your application for admission, and while you're waiting for your interview to be scheduled, the FAFSA results will come to our financial aid office. And then when you reach the point of receiving an offer to enroll, what should follow that is a financial aid award letter that will be sent from our financial aid office. And so they'll send you a document that will tell you what the cost of attendance is for the first year of the program, and then they'll give you some financing options to help pay for that. And then from there, what you'll want to do is map out a budget for yourself and decide, do I want to borrow 100% of the cost of the program, or maybe 80% or 75% or maybe 50%? Everyone's situation is different. And so it's important here to kind of map out a budget for yourself, figure out how you're going to pay for your program, think about all of the sources of revenue that you might have. It might be savings, it might be income from wages. If you need help with that budget, our financial aid team is a really great resource to kind of help you to walk through that whole budgeting process. So please take advantage of their expertise if that, if you feel that you could use some advice. Okay.
Mr. Luis,
Yes.
may I add something for the first scholarship that is listed there?
Yes.
I just wanted to add that the one scholarship that our strong scholarship, working with the underserved, the scholarship needs an application. I know that you said it quickly there. It covers 3/4 of your tuition roughly, and that application has to come with your application to WJC. That is all detailed in the website for anyone interested. But if you are a person whose mission and your history shows your dedication to working with more marginalized populations, please look at the requirements and consider applying to that. And the one kind of related to that, but we do also have in the Latino Health Program one scholarship for $10,000 a year for someone who plans to join the Latino mental health concentration, if any of you meet that requirement too. But thank you.
Thanks, Mari, and thanks, Joe, for your admissions presentation today. So again, this is our final Q&A session of the webinar. So it looks like we have a couple questions already, but still don't hesitate to submit any if you have them now. So first question we have here is the program CACREP accredited?
Great question. It's not. We have all the requirements in progress, and the application was considered, and it has not been processed completely for certain. That's a great question to talk to the director, but the short question is basically no, we're not. And it has been a very purposefully decision, at least for now, for us.
Okay, we have another question here about the field sites. Do you choose them or do you get assigned a placement? How does that work?
That is another great question. It's a combination of both. A field education a person with Mrs. Cohen, Melissa Cohen is our person that works in the field placement and faculty. She will connect with you, look at your resume, You would have a conversation with her, discuss your interests, and based on that, she will give the student 3 to 5 sites to start. So in that sense, she's choosing. Why she's choosing that? Because she would know what sites accept people with whatever experiences and interests that you are expressing. And then the rest, it's up to you. Then you do yourself the application to those sites. You arrange the interviews with the sites. And again, always along the side with our field placement person. So it's a combination of both. Yeah.
Okay, thank you. And then another question here, um, about how many hours per week is the workload for the online program?
Huh. Um, that is a regular kind of the same as the live. So I would say in academics, in classes, it would be like 10 hours direct contact. That's separate than your so 3 to 5 classes, and it usually goes from like 9 to 12 credits a semester. So if you count that on the live hours, but I will remind you that apart from the clinical seminar, which is a direct contact 2 hours with a professor, the other ones are in chunks. They have a lot of blogs, so people can do it, which is the purpose of doing the online, that people can complete the requirements at their own time. So I would say that without the practice, it would be a good 15 hours a week.
Okay, we have another question here. Can we work more than the required hours during the practicum and internship in part-time?
When you take part-time, you take only academics the first year. So I'm not sure what the question is. And then the second year, so let's say if you choose to be part-time, the first year you will take just academics, so classes. Then you enter your second time, you continue academics, which obviously the load of academics in the second and third year would be lower because you've taken a whole year of academic classes. And then you will have your 360 hours of practicum during your second year, and your 600 hours of internship on your third year. People in general complete more than 360 in the second year. I'm not sure if that's what you're asking. On average, it's like 12 hours. So people do like 2 days going to a site. So if a person is doing 2 days of 8 hours completely instead of 6, right there you have probably like 400 and something hours. Those hours, 360, which is our William James College requirements, are actually much higher than what the licensure requirements are. And we do that because we never know, right? People get pregnant and they have to take leave. People get medical issues and they have to take leaves, and these take care of a lot of. With COVID this year, because it was at the end of the year also, it ended up very practical, as our students did not need to complete the hours in person and were able to meet the requirements in spite of cutting short some of the work. So I hope I answered your question. If not, please, if you can rephrase it, that would be great.
Okay, thanks, Mari. If we move to the next slide, there's actually some contact information. So since we are about at time for the webinar, if we didn't get to your question today, if you think of something in an hour that you wish you had asked on the webinar or tomorrow, definitely reach out via email to any of the people listed here. Our faculty are always happy to answer your questions. If you have a specific financial aid question, Hillary Baxter can answer those, and she's amazing. So I definitely encourage you to take a moment now, if you haven't already, to download the PowerPoint from the handout section so you can have this information. Additionally, on the next slide, you can connect with us in a variety of ways. We're on all of those social media channels. We also have a very full website, so you can go to williamjames.edu, and we have tons of information on all of our programs. We have news stories on our student accomplishments, things the faculty are doing, events that we're holding. So there's a lot of information there, admissions. I definitely encourage you to check that out if you have additional questions as well. So thank you all for taking the time this afternoon to join our webinar. We hope that it was informational for you and that you have a great rest of your afternoon.
I just
Thank you,
want to
folks.
stress that anyone can connect with me, please, and I will be happy to also to then connect you with students who can speak about their point of view of the experience. Go ahead, Joe.
Nope, that was all I had. And again, I would just add that anyone who has any questions about the application process, always happy to have a conversation with you and to develop a strategy to put together the best possible application portfolio that you can.
Okay,
Thank
great.
you.
Bye, everyone.
Ciao. Good day. Hello, hello.